We've been spending a lot of time talking about the COVID-19 crisis and the hospital and ICU crisis in Alberta. Well, it turns out Saskatchewan's got something very similar going on. I'm going to talk to Dr. Alexander Wong, who's an infectious disease physician in Regina. So welcome to the interview, Alex.
Thanks, Markham.
Look, I'm going to read your tweet this morning because this is what got my attention. This AM, all adult ICUs in Saskatchewan are full. Surge beds are being created across Saskatchewan. Pediatric ICU in Saskatoon accepting multiple adult patients. All Saskatchewan ICUs short-staffed. Our critical care system is crippled. We expect exponential growth over the next 2 to 3 weeks. This is bad. This is not what I expect physicians to be tweeting. It sounds like you've got a crisis just as bad as Alberta.
Yeah, pretty much, Markham. Unfortunately, I mean, the dynamics are very similar. I mean, like Alberta, Saskatchewan opened up relatively quickly on July 11th versus July 1st, I guess, with Alberta. No restrictions, all public health sort of restrictions and mandates removed, including the need to actually isolate if you were COVID positive. I think we're the only jurisdiction in North America to actually have that in place. And again, I think the messaging, was very similar to that of Alberta. COVID was largely over. Vaccines are a way out of this. If you haven't already, go get vaccinated, do the right thing. And it was mostly encouragement over the course of the summer, like, please get vaccinated. And like Alberta, we heard relatively little from our policymakers, and things were quiet, in July and sort of early August. And then we saw the upticks. And here we are, the exact same situation, and essentially a week behind Alberta in terms of the measures and restrictions in place. Alberta sort of did the masking thing and so forth a week before we did. We announced last Thursday a universal indoor masking policy, as well as some type of passport certificate system, that won't actually be in place until October 1st here in Saskatchewan. But like Alberta, not surprisingly, we saw, a pretty significant uptick in terms of our vaccine uptake, first doses, and so forth as a result of that. The problem is that we're just too far gone at this point. And so practically speaking, we're in a situation here where unfortunately additional measures are probably going to be needed. Otherwise, we're going to be facing ICU triage, just like our colleagues in Alberta.
Okay, so it's a crisis. It sounds like, when I talk to physicians in Alberta, they say the acute care system, the hospital system is either collapsed or collapsing. Do you have the same, burnt out doctors and nurses that have left the profession because, now hospital shifts can't be covered, those sorts of things?
Yeah, it's all the exact same dynamic. I mean, everybody is just so tired. So again, when there's backlog basically across, the system in terms of the sickest people, everything just backlogs from there in terms of like your hospital capacity, your ER capacity. It all just kind of all backs up. And the most intense, complex places to work in our healthcare system, in the acute care system, at least like the hospitals, is really the critical care units and the emergency departments. That's where the sickest people are. That's where there's the most kind of going on, and where frankly you need, very specialized, well-trained personnel, especially nurses. This is really predominantly about nurses. I'm not going to minimize all the other professions, but really this is about nurses and respiratory therapists who are responsible really for looking after the sickest people sort of minute to minute, hour to hour. And we've just asked so much of all of those people over the last 18 plus months. Here in Regina, we got crushed with our third wave, and it was like a complete war zone here, doubling our ICU capacity, and we somehow managed to get through it. So to face it all again, and we're facing it, obviously, colleagues in Saskatoon and, central and northern Saskatchewan are facing it just like Alberta right now. It is that bad. And so that is why we can't just snap fingers and make more capacity, because we just don't have the staff at this point to really look after those people. And as you've heard in Alberta, this means potentially providing care that's not optimal.
Okay, well, I want to bring up an issue that may be different from the other waves, and that's kids. So prior to the rise of the Delta variant, kids either didn't get sick or didn't present with symptoms at least, but now that's changing. What does that do to the crisis we're talking about?
Again, I mean, for the vast majority of children, uh, COVID is going to cause relatively limited mild disease or even maybe no symptoms at all. The problem is now that with Delta being so contagious, us being back in schools, and again, the entire under 12 cohort, not vaccinated. Again, I mean, I think in Alberta and Saskatchewan, if you look at the numbers, close to 50% of individuals like in our provincial populations who aren't vaccinated are kids under 12. So they're going to be at super high risk of getting COVID, and they're all in schools now. So, I mean, when you have this kind of dynamic happen, and I'm not in any way, shape, or form implying that they shouldn't be in school, because again, it's been well documented that the kind of, sort of mental health toll that not being in schools and not having in-person learning has taken on all of our kids. I've got 3 kids under the like 5 years of age and under, and it's just been a dramatically bad thing. The problem now is we're right in the midst of this huge Delta surge, and our kids are trying to do school. We have no public health capacity, to kind of do that same sort of comprehensive test, trace, isolate that we did back in the spring with, and back frankly for the last 18 months. So it's just kind of creating a lot of chaos. And so unfortunately, what we're seeing now, just like we saw in most parts of the US, a large number of kids, being isolated and quarantined, it's just not a bad situation. And to answer your question, unfortunately, when you have this many kids get sick, just based purely on percentages, a small number of those kids are going to end up, requiring critical care support, or God forbid, end up dying. And again, I mean, that's never okay to watch kids actually get critically ill and heaven forbid, like have, children dying of COVID-19. But, unfortunately, that's just where we're at. And that's just purely a percentage thing. If you have if you have thousands of kids get infected, then unfortunately a small number of them are going to do poorly.
Well, final question, Alex, and I guess the obvious one is what can be done? We were talking, I've seen doctors talking about a circuit breaker, maybe a month of severe lockdown or longer. What's your take on that?
I think we're in a situation now, unfortunately, where if I had to hazard a guess, I think along with, a lot of my colleagues in Alberta and so forth, I would say that we're probably too far gone at this point to avoid, the reality of ICU triage. That sounds horrible, but I think that's where we're at. Again, we know that whatever measures we put in place are going to take 2 to 3 weeks to really kind of see significant impact. That doesn't understate how important it is that we put very aggressive measures in place as soon as possible. This is about trying to bring our curve down as quickly and as aggressively as possible to minimize the amount of time where we can't support everyone from a critical care perspective. We should never, in my opinion, at least at a societal level, in a first world society where, we're living in provinces like Alberta and Saskatchewan, be in a situation where we can't provide, the best possible care to everyone who needs it. And this isn't just about people who have COVID or whether you're vaccinated or not vaccinated. I mean, if I'm just driving down a gravel road and I take my eye off the road for a moment and flip my truck and have some horrible trauma happen, there's no ICU bed, I could die because there's just no capacity for me. And that's just the reality of where we're at. This should never be a situation that we should find ourselves in at a societal level. So the quicker and the more aggressively and the most definitively we can put these measures in place, the quicker we can get out of this. But again, all the modeling shows that we're still going to be on a very steep upward trend for the next couple of weeks. And that's a scary place to be right now, Markham.
Well, just to clarify one point that you raised, Alex, and that is triage. So as a non-medical professional, I understand triage to be when you walk in the door or you brought in by an ambulance, the doctors and nurses have to look at you and go, okay, you're hurt this bad, and you either, maybe you're not hurt bad enough, and we take a COVID patient over you, so it's like a medical, like on a battlefield. And is that what it is? Is it that bad?
That's part of it, but let's just kind of assume that we have, say, I don't know, 5 individuals who, let's not say 5, let's say 3 individuals who all come in relatively at the same time, and they're all critically ill, like needing life support measures immediately. So let's say I flip my truck and have huge head trauma. and I need like surgery right away, and I need to go to a monitored ICU bed, where I'm going to recover. And let's just say there's one individual that comes in and they have like a really bad infection that's got nothing to do with anything other than just bad luck. And they're septic, they're in septic shock, they need life support measures. And then you have a third person who has COVID and they can't breathe, they need to be intubated, they need that, again, life support, respiratory care, and so forth that only our ICUs can provide. If we don't have the capacity to support all three of those individuals, right at that moment, right at that time, then people will die. And, I don't know how you make those kinds of choices, but obviously both in Alberta and Saskatchewan, there are frameworks put in place to basically decide in that kind of situation who has got the best likelihood of having a good clinical outcome. And that's essentially how we decide who's going to get the resources, who's going to get the bed, who's going to get the staffing versus who won't. And if you have 3 critically ill patients that need intervention within a matter of, a few minutes to an hour or so, otherwise they're going to die, that literally is what we're looking at. So that's the most extreme form of triage, but that's the reality of where we're at. And it's because of our staffing capacity, all the rest of it. So it sounds really scary, but again, this is now not the time to do anything non-essential or to get into trouble in any way. Like, don't get on your roof and try to like fix your shingles or something and fall and have some big trauma. Like that is the reality of where we're at right now. It's that scary. It should never have come to this.
Well, I'm going to close out with a little bit of a personal anecdote, Alex, because in April 14th, 1993, I was living in Prince Albert and I was hit by a drunk driver at about 80 kilometers an hour. They had to cut me out of my car with the jaws of life and put me in an ambulance and race off to the Royal University Hospital in Saskatoon. I got there. The doctor said later that I was about 15 minutes away from bleeding out and dying. And so for me, this is a very personal story. I mean, if that happened today, I might not make it. And that's an example of, I was just out minding my own business and somebody who was a habitual drunk almost killed me. And so it can happen to anybody at any time. And now is not, as you point out, hopefully not the time.
We don't ever want to be in a situation as healthcare providers, and as a system to have to make these horrible decisions. And, I think it's still very abstract to a lot of people who believe that this is just about people who haven't been vaccinated versus people who have been vaccinated. But you know what? At the end of the day, if you're just kind of driving and you get hit by someone, or, if you're in labor and you just have some sort of bad complication happen, that could be any of us. That could be our mother, father, wife, husband, kid. And all of a sudden, what you take for granted all of a sudden is going to be there. And that is just a tremendously scary place to be right now. And that affects us all. So the quicker we can get away from this and out of this, where we don't have to make, and be threatened with these kinds of horrible decisions, the better off, I would say, at least at a societal level, that will be. I mean, my job, I feel, as a healthcare provider is to advocate for lives and to advocate for my fellow colleagues. We don't want to ever be in this kind of situation, but that's where we're at right now. And it's just really scary.
Alex, good luck.
Thanks, Markham. Take care.